people don't always understand too. Like acupuncture and Chinese medicine is evolving. There's so many people I can think back of that they've gone through, so many difficulties to fall pregnant. You do still see the people who come to you and say, I lead this really stressful life and I feel like it's impacting my health and fertility, but, my doctor said it doesn't play any role.
How do you respond to critics who claim that there's not enough scientific evidence to support their role in fertility treatments like IVF?
I guess that's what's worked for acupuncture. Everyone just sees, actually worked. Although we can't explain every single time how a different sort of point or a different formula works, the outcomes have been the thing that has been really driving it.
What advice would you give to someone who's considering acupuncture and Chinese medicine as part of their fertility journey but is hesitant to try something outside of the conventional medicine mold?
There's very little side effects, adverse reactions that you're going to get to it. It's going to be a lot more affordable and approachable.
Do you ever worry that patients might avoid necessary conventional treatments by pursuing more natural methods?
Yeah, our treatment's not always successful. It's always better than, going down the most extreme path and then sort of later on thinking, I could have done this, or I could have saved tens of thousands of dollars.
How important is male reproductive health?
To tell you the truth,
Caleb, it's cool that you're here.
Thank you for having me.
Yeah, I'm excited. Caleb and I work together at Pagoda Tree.
Yes.
And I've tried to figure out today how long you've been at Pagoda for.
It'll be 10 years in August.
I was going to say it's 10 years. Yep, that's a long time.
I know.
Thanks for sticking around.
Yeah.
But
Quarter of my life.
I know. My goodness, that is a long time.
Yeah.
But over that time, I feel like you've really come into, various iterations of you as a practitioner.
Definitely.
And with that, we find our areas that we love treating.
Exactly, yep.
And what's that been for you?
Fertility, that's for sure, yeah. And I think, when I first turned up for an interview at your clinic, and I was, to tell you the truth, I was probably just going for it because it was a great location and I loved Albert Park and I thought it'd be cool working in the area, but definitely I've evolved into it and it's become a big part of my life, I reckon, the fertility acupuncture. And yeah, it wouldn't have happened if I hadn't have come into the Pagoda Tree and met you, Nat.
Well, our patients love you and I'm certainly happy that it's been 10 years. But let's talk a little bit about acupuncture and fertility and some of the misconceptions. I think there's, it's very interesting. 10 years ago, it was very different than what it is now.
Yeah, that's right.
And, acupuncture and Chinese medicine can be very much a standalone thing that you can do when you're looking at improving your fertility.
Definitely,
but in more recent times, there's a lot more information available about how it can support assisted conception and IVF.
That's right, yeah.
What's been your experience with that? Can you think about kind of where it started and where it is now?
Yeah, well, I guess as much as anything too, it was really seen as very alternative, maybe even a bit further than 10 years ago. I think roughly 10 years ago was when, a lot of the private health insurers were getting on board. So obviously that means it becomes a bit more doable for a lot of people when they know they don't have to pay fully out of pocket for sessions and things like that. But, nowadays you see we have practitioners that are working in hospitals that are assisting, doctors and surgeons in the same sort of rooms and clinics. A lot of referrals, nowadays come from GPs and fertility specialists and things like that, which was, would have been totally unheard of 10 years ago. And I think that's just evolved because I guess there's been a lot of research, but there's also just been a lot of great success, which has pushed as much as anything.
I think that's true, actually. I never forget a fertility specialist saying, I don't know what it is you do, and I don't know that I believe it, but you're helping with our outcomes. So just keep doing it.
Exactly. Yep.
So for those, though, however, there are people that still say it's pseudoscience. And how do you respond to critics who claim that there's not enough scientific evidence to support their role in fertility treatments like IVF?
Well, yeah, I guess when you look into it, there are lots of great outcomes, and when there's always been research around acupuncture, the outcomes are always there. But the difficult thing with acupuncture and Chinese medicine is, trying to explain exactly how it works on the, I guess, microscopic level or the scientific level. And there isn't, I guess, one reasoning that explains acupuncture or Chinese medicine in a whole. So that, I guess, really annoys a lot of scientists because they're like, sometimes you're saying it helps with blood flow, other times you're saying it helping with regulating hormones, or and there's not one, I guess, description for acupuncture or Chinese medicine that you can holds up scientifically every single time. So I guess that's always the difficult sort of thing. But I always point back to people that Panadol is used by everyone around the world on a daily basis, and they still don't have the exact pathways in which Panadol works, but it's accepted. And I guess that's what's worked for acupuncture. Everyone just sees, oh, it actually works. Right. I've tried it. It's worked for this. I've tried it. It's worked for that. And although we can't explain every single time how a different sort of point or a different formula works, the outcomes have been the thing that has been really driving it.
Yeah, I think that's interesting as well, because there are people that will say they've had it and it hasn't worked.
Yes, yeah.
But also, I would ask who's performing it, because
exactly, yeah.
There's acupuncture and there's dry needling, but there's no real need to differentiate the two.
Yeah.
It's frustrating.
Yeah, it is, yeah, that's right, yeah.
Especially like when someone actually does that. Well, it's like anything. Someone comes in and says, oh, I've taken a supplement and it didn't work.
That's
but
right.
It wasn't even actually prescribed or recommended. They just heard that their friend said to take it.
Yeah, exactly.
So it's important, I think, to see someone that knows
well,
what
that's
they're
right.
doing.
And everyone will go to a doctor for, some condition and get the wrong prescription, or need to go to see a different specialist for sort of things. And I guess it is a little bit different. If you go to the doctor and say you've got a sore throat and they give you antibiotics and it doesn't clear up, most people will not say, oh, no, that doctor didn't work, I'm not going to go back to them. They'll probably just go back to the doctor and say, no, that didn't work, can I try something else? Whereas I guess with a lot of alternative therapies, if they go and it doesn't work, they're not sort of thinking, oh, maybe just that treatment that they performed didn't work, or that practitioner didn't do the exact right thing.
Yeah, it's so true.
Yeah.
Some people argue that relying on alternative treatments like acupuncture could delay conception, like you're not actually taking the appropriate or more aggressive intervention that's needed. Do you ever worry that patients might avoid necessary conventional treatments by pursuing more natural methods?
Yeah, well, that is definitely something that you I guess, talking to people about daily. And it is, you never want to step on other professionals' toes, or, try and say that you have to do this, over something like that. But I guess particularly with natural medicines and things like acupuncture, there's very little side effects or adverse reactions that you're going to get to it. It's going to be a lot more affordable and approachable, and it's one of those sort of things that I think it's a stone that you need to sort of look under before you do go for quite a aggressive sort of or more invasive type treatments that one, cost a hell of a lot more, and two, come with higher risks. And I guess why would you jump straight to the most full-on type thing when there's often a pathway before that might get you the same result with far cheaper and far less adverse effects.
And it's not always successful.
That's right. Yeah, exactly. And I mean, neither is our treatment is not always successful. Going straight to assisted fertility is not always successful. But I think if you look out there and take other approaches, I think it's always better than going down the most extreme path and then sort of later on thinking, oh, I could have done this, or I could have saved tens of thousands of dollars. And
also improve my health along the way.
Well,
so
yes,
I always
that's
say
right.
to patients.
Exactly. And no matter what, whatever we do, we're going to still prepare you and get you in an even better spot for any assisted fertility.
Which is why I think also it does help improve other assisted conception outcomes.
Exactly.
Because you're actually looking at the body as a whole, not
That's
just
right.
the reproductive system.
Yeah, and that reminds me of one other thing too. When you do come to see acupuncturists, naturopaths, dietitians, they're going to give you a lot more time than if you are seeing a fertility specialist or a doctor too. And that is a great way to uncover things about your exercise, your lifestyle, what you might be eating, your sleep routines that they will go through possibly when you see a fertility specialist, but they're not going to have like a half an hour or an hour to really, delve deep into these
Which
things
is really important.
Which is exactly, but particularly to do if you are going to then still see that specialist as well.
One thing I think that is really important is looking at stress when it comes to fertility. And I've definitely had patients that have been told that it doesn't matter.
Yep.
I think it's often overlooked, to be honest, when it comes to even assisted conception.
Yeah.
How do you help your patients manage stress, and what role does mindfulness play in improving outcomes, do you think?
Yeah, well, I do think that the whole stress component is being more recognised in every field. But yeah, you do still see the people who come to you and say, I read this really stressful life and I feel like it's impacting my health and fertility, but, my doctor said it doesn't play any role. It plays a massive role. Like everyone sort of, will benefit from some sort of mindfulness or things to lower their stress, whether it's just improving their sleep or getting rid of, tension in their neck and shoulders. But it has a lot more to play in other functions of your body, your digestive system, your fertility. And when you have high levels of stress, your body will always focus its energy towards getting, energy going to your heart and lungs and your muscle tissue, and put things like your digestive system, like your immune system, like your fertility system, either slow it down or even put it on hold sometimes. And you see that with people who, maybe have a regular cycle, but then when they're really under stress or they're traveling and not sleeping well, they'll skip a cycle or they'll have a really long cycle. And it's, quite obvious in lots of ways.
I know. I get quite frustrated with that. But here we are. And I think also that is something that's said to people, because when we are, especially let's say IVF, we're very much isolating things and just really manipulating hormones.
That's right.
So that's why I think that is said to a patient, stress doesn't matter at that point because I'm controlling everything.
Yep, exactly.
But to your point, it really means that your hormones aren't a priority at that point in time.
And even you might not be getting the best out of your medications if you're under a lot of stress and not sleeping well, or not eating right, all those sort of little things too.
You've spent time learning not just in Australia but China, Taiwan, Thailand.
Yep.
What was one of the most valuable lessons that you took from those experiences, and how has it shaped your approach now when it comes to treating women or couples?
Wow. Yep. That's a
big question.
Yeah. Look, as much as anything, what I've come to appreciate is how good the health system really is in Australia for private health insurers, offering coverage for alternative medicines, for alternative medicines being more acceptable in hospitals and clinical settings, because practicing overseas and particularly in China, it's definitely accepted, Chinese medicine and acupuncture, but I guess the settings of it all are a lot rougher and tougher. When I was living in China, we worked in different university hospitals and things, and the strain on the system meant that you were seeing often, 30, 40, 50 people a day in rooms with beds of 8 people.
Wow.
There wasn't often heating or cooling depending on what time of the season it was. And people put up with a lot to get their health right compared to here. And that's probably the biggest sort of difference and thing that I appreciate about working in Australia and the Australian system too.
I never got to go to China. When it was time for us to do that was when we had our SARS outbreak, so I never got to go. But I remember watching videos of what they were practicing in the hospitals, and it actually did look barbaric.
It was crazy, and some of the things that we witness over there and the practices, you'd be blown away by. Like I remember there was a group of students that would be going and assisting with acupuncture on amputations, and we'd see people who had suffered from gunshot wounds.
Wow.
Like it was just totally full on and
hopefully not something you ever have to treat.
Exactly. I can't say that I've used a lot of those experiences back here, but
well, that's also what I say to people sometimes, because obviously Chinese medicine and the philosophy and principles it's based on is very old.
Yes, yeah.
Yes, it stood the test of time. How relevant, though, is it still in modern day living? Because a lot of the issues that we see are a result of modern living.
Yeah, yeah.
And so sometimes I'm a bit torn. I'm like, I mean, yes, okay, I know we can. What I think Chinese medicine does very well is it kind of fills the spaces in between that we don't have answers for sometimes.
Yeah, that's right.
But do you ever feel like some of the things that we learnt, well, you just said you've never used, they're a little bit outdated?
Yeah. Well, look, I guess, this is another good thing that people don't always understand too. Like acupuncture and Chinese medicine is evolving as well. Like we do definitely, have a lot of classical texts that are hundreds and even, a couple that are thousands of years old, but it's always evolving too. It's constantly being studied and researched, and even if you look at the way that it's often taught, Chinese medicine itself, when it was practiced in China, had different sort of subsects for different provinces, which with what they're taught nowadays is actually sort of taking of the best parts from each of those different subsects as well. So with that, people are still, changing sometimes where they might locate different points or altering herbal formulas, that have been used for centuries, but just changing one herb or two herbs in them. So it's, I guess, still lots of relevance for what we have done in the past and the really ancient forms of Chinese medicine, acupuncture, but it is also evolving and changing with, what people need treated and everything, basically as well.
I think it's. I mean, like any modality, it's got to evolve. Otherwise, it wouldn't still be here.
That's right. Yeah.
But to that point, also, it has definitely stood the test of thousands of years.
Yeah.
Which is the part that I laugh at when it's kind of said to be pseudoscience or something that doesn't work. It's like, how does something that doesn't work still exist then?
Yeah, exactly. And have been used by, the Chinese population's, in the billions, so it's sort of like
they've done
there's
something
a lot
right.
of people that have given it a go,
So for the person that's listening and maybe really curious, never seen a practitioner, never had acupuncture, doesn't really understand how that would even influence their fertility, what would a standard kind of first encounter that someone comes in, maybe explain what it is that, the conversations that you would have, what you would do in that first initial consult?
Yeah, well, look, I guess as I sort of touched on earlier too, like acupuncture, alternative therapies are always very holistic. So when you have an initial consult, it's not just going to be what's your main main concern and how can we fix that. We will always sort of look in depth into your lifestyle, your diet, your exercise, your emotional health. So the first part is always, going to be quite in depth, looking into lots of different aspects of your health. Then if we will often choose to do acupuncture in a session, or we might add in herbs as well, but we're not going to just jump and stab you straight away. We'll sort of talk you through like the different areas that we're going to treat and work on. I always sort of explain to people just before we start too that with a acupuncture session, we take a long time to choose the points that we're going to use. But if there are some areas that you're not sort of comfortable with, you can always talk up and speak up. We usually will use, a minimum often of 10 points, and it can be up to 20 or 30 sort of points, but it's not that we have to use those sort of points. We're using a range of points so that we cover a number of sort of things. So I always say to people, feel free to say, no, I don't like, any points on my feet or hands or on my tummy or something like that. But when we sort of start off with the treatment itself, I explain that, it's very relatively pain-free. And if anything, usually the most ever you're going to feel is similar to someone sort of just plucking one hair on your body. And that is only for an instant as well. And once the points are in, what a lot of people will feel is an overwhelming sort of calming feeling. They will often feel sort of heaviness or pressure in some of the points. They'll notice often, sort of warmth or more circulation in the different areas that we're working in as well. But as much as anything, an initial consult is a lot of talking, listening to what's going on with your lifestyle, talking and explaining how we might be able to assist or what we can do, and then you choosing sort of, yep, all right, that sounds good. I do want to work on my stress, or yep, I do want to do stuff to improve my digestive system. And yeah, it's not just come in, what's your main complaint, jump on the table, throw a needle in.
Absolutely. Do you have any favourite or standout patient cases that you can think of that you were just like, this just still sticks in your mind?
Blows your way.
Yeah.
Oh,
I know, putting you on the spot because you probably had a lot.
Yeah. But, to tell you the truth, I have loved working in fertility because it's so rewarding. And the main thing I always say to people about why they ask, why do you work in fertility? Why do you like fertility? Is because it's so rewarding. And I give them the example that I did when I initially started practicing. I worked for a chiropractor and in musculoskeletal health. And I say, when you get a successful treatment, if you fix someone's back pain or neck pain, you wouldn't often hear from them. The success was that they were gone, exactly. And more so on top of that, you'd never, get a photo of someone standing up saying, look how good my back is, like I can stand up all day now. But fertility, you always do get that response. You get photos from people who you've, worked with through different things to help assist them fall pregnant. There's so many people I can think back of that they've gone through, so many difficulties to fall pregnant, miscarriages, people that didn't have cycles that thought it would be impossible to fall pregnant. People that have sort of often have used assisted fertility but falling pregnant in their late 40s, even early 50s, that I guess always stick in my head. But yeah, one off the top of my head, I wouldn't say, I couldn't say there would be one. I just, there's
Lots.
thousands I can remember like that. Yeah, that I really am happy to have been involved with, basically. Yeah.
A lot of what we've talked about is about female reproductive health.
Yeah, yep.
But how important is male reproductive health?
Well, and look, to tell you the truth, that is something that even for a lot of my guy friends, it would still not be discussed. But there have been, great sort of football players in big positions that have, recently come out and talking about male fertility and the male fertility side. And really, it is most of the time it's a 50-50 sort of reason for infertility. So it's huge, and it's probably one area that is undertreated in lots of ways, but really should be a bit more proactive. Because the other thing I say to a lot of couples when I first see them, if a woman has to do a lot of fertility treatments and checks and things like that, really the male side should be checked first, because it's the most simple and easy.
It's the easiest thing to fix.
And for a lot of time, a semen analysis is a lot easier than internal ultrasounds, blood tests.
So true. But getting men to do the testing is near impossible often. I think they really don't cope very well.
Which is surprising, because if you think about the test itself,
it's really
for a lot of guys, it's not too tricky, like not going to be too painful. I hope not anyway.
So true, but it's very common that women will say, my partner won't do a test.
And it's cheap and easy too. It's very easy, cheap thing to go to even just your GP to ask about getting a semen analysis done. Yeah, and look, there are other things guys can test and should sort of check and test too, but the biggest one is very, very cheap and easy to do. Yep.
Right. But also it's kind of heartbreaking too when you've been treating a patient for a number of months and then you kind of go, probably should have checked your partner.
Yes.
And then sperm health really is a sort of a 3-month cycle.
Well, that's right. Yeah, exactly. It is often a lot quicker and easier to treat too. So I'm sure it surprises you too, Nat. Like, it always surprises us when we, go down this path with a woman's treatment for so long, and I mean, we are pretty thorough in checking and going over, what your partner is doing, and often getting them to come in for consultations too. But if anything, was to change in the fertility world, it would be men go out and, do your tests first, if anything. Yeah.
I think it's so important. Also, with that in mind, and we're seeing a lot of women now freezing their eggs. And you're also working in an IVF clinic.
Yep.
Have you had any experience, or what have you seen much success with frozen eggs rather than frozen embryos? We know frozen embryos is completely different.
Yeah.
But I guess women now are just starting to use the eggs that they might have frozen.
Yep. Look, I think it has a very similar sort of outcome to fresh eggs and fertilization, to using the frozen eggs and fertilization. I guess the thing and the reason it is becoming so popular and a lot more people are doing it though as well is that when you get your eggs frozen, it is really like sort of putting money in the bank or putting something aside to save your health or your quality basically for later on. But I guess as much as anything, we still do see a lot of people using their frozen eggs with fresh eggs as well. So to say the truth, I would still say there's not a lot of people that do just use their frozen eggs for fertility and for fertilization and then to get to embryos and then to go down sort of IVF transfers and things. But I know for a lot of people, it is a big weight off their shoulder if they do, an egg freeze and save some eggs when they are younger or before, certain treatments that might affect their fertility and things too.
I think what's interesting there is I always say to patients, if you're going to be stressed about not conceiving, thinking there's a timeline because there's a lot of pressure around, the biological clock being something that's ticking away.
That's right, yep.
I think maybe just the relief that they can have in just having that there might be that person that needs that relief.
Yes.
But there could be the other person that doesn't need that and they're completely fine to maybe not do an egg collection and freeze their eggs.
Well, that's right, yeah. And I do always say it is more like a safety net because a lot of people, obviously do it when they're younger. They're doing it before they're ready to conceive. But it is, like having that safety net. You can still try in the future when you're ready to conceive. But if you do an egg freeze and have that safety net, if it isn't successful when you are a bit older and ready to conceive, at least you know that there's something else there you might be able to use to achieve pregnancy.
And for those people that are listening, whether it's actually freezing eggs or IVF, how important is the preparation in your opinion?
Massive. And this is, I always sort of say to people and anyone doing fertility that having your eggs collected for egg freezing or for IVF that's the most important sort of thing you can ever do for your fertility. And it's not something you can improve with a couple of weeks sort of notice. So we do always recommend that anytime you're preparing for something as serious as that, and I mean financially serious, I mean obviously outcomes to your family sort of serious
physically
too,
as well,
that you do need to put in the prep for that. And we often sort of quote sort of 3 months as a good preparation time, but really as much as you can do is really important because your eggs that are collected during egg collections are coming through your ovaries. Well, they're already in your ovaries, when you're born, but they're coming through ovaries in preparation for collection for months before they are actually collected too. So doing all the right things like staying off alcohol, not smoking, eating right, making sure that all your vitamins and minerals are at the right levels needs to be something you're doing for minimum of 3 months and hopefully more. And the same with even the things like folate and things that can contribute to different birth defects and spina bifida and things can't be just done like a week or two out, need to be worked on for months.
I always say to patients, from that point in time where you decide you're going to do an egg collection, you probably shouldn't stop. Whatever it is that you've done to prepare, you should keep doing after the collection because that's also really important in terms of looking after your health and fertility.
Well, yeah, you'll be very
long-term.
depleted too
Right.
after a lot of stim meds, and a lot of women are, if they're having natural cycles, will be producing sort of 1 egg per month. You're, hopefully going to be producing 10 or more, and that takes a lot of energy and a lot out of your body too. So it's not like, you have that and then you sort of relax. It's like preparing for a marathon. After the marathon, you don't stop eating and you don't do any non-recovery. You
Right.
need to recover.
So true. I think a lot of people
eat.
just feel relieved that it's over and then just go back to resume as they were before.
That's right. Yeah.
I actually think the biggest insurance policy is looking after your health,
Yeah.
and being very focused and diligent on whatever that means. And I think also as we get older, we don't have the flexibility that we used to have as women. We actually have to almost every month course correct. What did my cycle tell me this month? Okay, what have I got to do so that doesn't happen again? We don't have that flexibility that we had in our 20s and early 30s where we could burn the candle at both ends and we could get away with, nutrition not always being dialed in and not sleeping enough and all of that.
That's
so
right.
it is, I think, just important. It's not a set and forget scenario. We still want to keep our health our fertility
Yeah, well, that's right. Yeah.
at the forefront.
And then for being a parent too,
that's true
don't want
too.
to deplete yourself getting to that point and then have the kid
Well, I mean, that
you're here,
happens.
so it's all good now. But no, that's
That
when you
really
really need to
happens.
start working on your health.
It's true, though. You think about some people's journeys in their fertility, and they are so depleted by the time that they fall pregnant, and then they've got to actually look after a child at the end of it.
Yep.
It's wild.
Yep.
What advice would you give to someone who's considering acupuncture and Chinese medicine as part of their fertility journey but is hesitant to try something outside of the conventional medicine mould?
Well, I would say it's the results are there, that it really assists in any sort of any time frame of that fertility journey, whether it's your first port of call, whether it's coming to it because you've already been down the assisted fertility journey as well. And I'd say, the results there, as I mentioned to you before, if there's some parts of the treatment that you're apprehensive or scared of, you don't have to go ahead and do them. But it is always going to be very holistic. So we're going to have that extra time with you. We're going to go in depth into lots of things about your health. And I'd say that I don't think anyone would come in and leave a session thinking I got absolutely nothing out of that, because we have that extra time. We do look at you holistically, and why not equip yourself with more knowledge if you're going down the fertility journey.
And also find someone who actually knows what they're doing when it comes to fertility. So
yeah, that's right.
I think that's really important, actually.
That's right. Yeah, exactly. Yeah, and look, a lot of clinics will differentiate themselves whether they treat sort of musculoskeletal conditions, whether they just do things like dry needling or sports science. But if you're looking for fertility sort of treatments and fertility support, do research, look for clinics that specialise in that area.
Awesome.
Yeah.
Caleb, thank you so much for joining me today.
No worries.
This has been fun.
Thank you. And here's to another 10 years.
Oh, here's to another 10 years. Yes, amazing.
Yeah.
We'll be fabulous at that point in time. Well, you don't age. You still look the same as you did
you
when
do
we first
too.
started.
Yeah, and you've got more energy now than I think than when we started too.
Oh, it just keeps growing. Thanks, Caleb.
Thank you.
Hey there, it's Nat Kringoudis, host of the Wellness Collective podcast. I know how important it is to have a safe space for women's health, and that's why we created NK the Membership, an online sanctuary where you can access expert guidance and support right from home. Get early access to monthly masterclasses, unlimited access to our entire catalogue, and practical resources to achieve hormone harmony. Plus, enjoy a 20% discount on supplements and join my monthly live Q&A sessions. Join our community of like-minded women and wellness experts to revolutionise your health one topic at a time. Visit our website and sign up now. It's legit Netflix for hormones.